The Department of Pathology at UAB makes thousands of diagnoses for patients each year. Of an estimated 150,000 annual visits at UAB Hospital, 90% of patients require some form of pathology service. Timely and accurate diagnoses are critical to determine the best treatment options, and yet, reaching those diagnoses can be a very complex process. Together with our excellent clinical teams, I would like to take you on the journey of a pathology specimen to highlight all the steps and, above all, the people involved through the process. On our journey, we're following a uterus specimen, which is delivered to our accessioning team. The specimen begins its journey towards a diagnosis by being established in our database and appropriately labeled and matched with relevant patient history before being delivered to the microscopy lab. In the microscopy lab, our skilled team of pathologist assistants and trainees work to properly section and analyze the specimen, taking note of its characteristics. Once representative sections of the specimen have been submitted into appropriate cassettes, they must be fixed in formalin and processed in various chemical solutions. Our uterus specimen will soak in these solutions for 8 to 12 hours. Once a specimen has been processed in solution, it is embedded into a wax block, which allows the specimen to be thinly sliced by trained laboratory professionals to create glass slides for pathologists to examine. The thin wax pieces must be processed through a series of solutions and stained with hematoxylin and eosin to make its property visible under the microscope. Once stained, the case turnout team organizes the glass slides in folders with the correct paperwork and assign the case to a specific subspecialty service. A trainee in that subspecialty rotation will preview the case before assigning it to its specified faculty attending. Standard H&E tissue stains show the overall shape and structure of cells, but frequently faculty will need to order additional testing necessary to make the most accurate diagnostic interpretation. Our immunohistochemistry laboratory performs immunohistochemical testing essential in diagnosis cancer type and biomarker expression. These tests generally takes an additional 1 to 2 days to complete, depending on the volume. Other tests that may be likely to be ordered are molecular testing, which requires DNA and RNA extraction from the sample. The final step in our specimen's journey is its pathology report construction and verification. Once all test results are available, the case is reviewed once again by an attending with subspecialty expertise to determine and verify the diagnosis and complete the report, which clinician will have access to and share with the patient. Our patients are the driving force behind our commitment to diagnostic excellence. Beyond every specimen is a person, a story, and a journey, and we never lose sight of the human being behind the diagnosis. Every case we sign out carries a responsibility that we hold deeply and never take for granted. We're proud to care for our patient in Birmingham and beyond, and honored to be your pathologists.